My name is Jenny Azarian, and this video is for Laboratory Animal Management, VTHT2213. Going over some basic husbandry and care for rats. Gus is here for his appointment today, and he is housed in a solid bottom shoebox cage with the wire top here. His cage at home is pretty similar style. It's just got a couple different layers for him to roam around and exercise in. This is just kind of a small travel cage. So Gus is here for his appointment today, and we have a couple things to go over. So rat diet consists of a commercial rodent pellet. I'll take the top off and show he's got a couple in his bowl here. Okay. So the rodent pellet is designed for them to kind of gnaw on them throughout the day, and it helps them to keep their incisors at an appropriate length. Typical rodent pellet diets should contain about 20 to 25% protein and about 4% fat. You can also give your pet rat some fruits and vegetables or seeds kind of as treats, but important in small amounts. Gus is just here for his appointment, but if he were to be staying with us, it would be important to provide identification, make sure we're working with the right patient. So here's an example of something we use here at the hospital. It's a cage card, and this would be kind of affixed to his cage here, and it has his first and last name, the species, the doctor treating, what they're here for, and any treatments throughout the day. Another kind of temporary identification you can do is use a colored marker on their tail or their fur coat if it's light. Some other permanent methods of identification that they use a lot in labs is ear tagging or notching, microchipping. You can also tattoo the tail or the ear or even the toe. But Gus just has a cage card here just for an example. He's got nice, soft, absorbent, non-toxic bedding in the bottom. I always like to give them a little extra bedding to encourage burrowing and nesting. They like to do that. He's got a little house here that they made, so he's hiding in there. Definitely important to have access to fresh, clean water at all times. His water bottle's at the back here, and it's just this hanging water feeder that he can drink throughout the day. So temperature is pretty important for rats. Anywhere between 65 and 75 degrees with a relative humidity of 40 to 60% is sufficient. Low humidity has been known to predispose rats to a condition called ringtail, so that's important. It's also important with rats to keep them in a quiet area, especially if they're staying in the hospital with you, just to keep stress at low levels. So enrichment is a very important part of your rat's everyday life. It can be provided in many different ways. There's tons of products out there just for the enrichment purposes. One important aspect of taking care of your rat is just getting him out every day and handling him. Most rats are pretty docile. They typically like to be handled. And so the more you get them out and handle them, the better. Exercise is a very important part of enrichment. You can get exercise wheels, little balls that they can go in. Rats definitely like to explore. He's in his little makeshift house here, so he can kind of burrow and make a nest, whatever he wants to do in there. So typically, like I said, I provide extra bed because nesting and burrowing is definitely a behavior of rats, and it's good to encourage that. He has some little chew sticks in here. This just encourages the gnawing action of the teeth, since like I said, they do grow continuously throughout their lives, so it's good to keep those at appropriate lengths. Like I said too, his cage at home is much larger and has a couple different levels. Rats love to climb and explore, so any way you can provide that, whether that's having multiple levels or kind of giving them toys that they can kind of utilize exploring and things like that. Hey, buddy. But handling is definitely really important knowing how to, and he's actually a pretty cool guy, and most rats like to be handled. I think right now he just wants to go into his little house because he's in a new area. But definitely getting him out and playing with them, whether it be a certain room in your house, or like I said, just a really big cage that you can kind of interact with him is really important to provide enrichment. In order to recognize rats as a species, one of their main characteristics is their very long tail. It's actually 85% of the rat's body length, and it's covered in scales. The tail helps as a mechanism for balance, as well as to regulate their body temperature. Rats have a fusiform shaped body, so it tapers at both ends, and adults can weigh anywhere between 200 to 500 grams depending on the species. Gus here is still a juvenile, so he only weighs about 250 grams. They have somewhat bulging eyes, and their teeth are hypsodontic, meaning that they grow continuously throughout life, and they have those characteristic upper and lower incisors. We'll be demonstrating how to restrain a rat. A lot of times rats are very friendly and you can just handle them, but when you need to restrain for any kind of procedure, it's important to stabilize two things. The first is you can do a scruff, and as you can see, I'm just kind of grabbing behind, and then I'm also holding the base of his tail as well, just like so. I know, buddy. So we'll be demonstrating how to sex a rat. As you can see, we have a male as indicated by the large anogenital distance from the papilla down to the anus. We have the presence of testicles inside the scrotum, indicating that it is a male. Brief overview of reproduction in rats. The onset of puberty can vary between males and females. With females, it's usually between days 37 and 67, and in males, it's about days 40 to 75. In rats, regarding reproduction, females are continuously polyestrous, and they have an estrus period of about 4 to 5 days. They also go through a postpartum estrus, which occurs about 20 to 24 hours after parturition. Breeding normally occurs at night since they are nocturnal animals, and there's a copulatory plug that's present. It consists of the dried semen from the male mixed with the secretions of the vagina from the female. This is usually used to confirm mating since it persists about 12 to 24 hours after mating. Gestation is approximately 22 days, and litter size can be anywhere from 6 to 12 pups. Okay, so we'll be giving a sub-Q injection. You just make a little tent and then inject, just like that. And you can pinch it come out. Demonstrate how to do oral dosing of a rat. And so the biggest thing when you're giving something orally is to go through the gap on the side here. And then what they'll do oftentimes is just grab right onto it like that. There you go. And there you go, you can see he's taking it really well. Get a little closer, you see, just see it, blood coming out of my syringe. Here we go. Okay. So I'm just going to go over some basic health care and husbandry practices for mice. Bostwick is here with us at the hospital today. He's in a travel cage, and we have away from other more loud animals just because mice are prey species and they can get stressed very easily. He has an identification card so we can know who he is. Has his name on it, the doctor who's treating him today, any technician notes and treatments. So that's one way we can identify him. And then there are several other ways to identify your patient, especially in mice. You can use a non-toxic marker to mark their tail or their hair coat. There are also forms of more permanent identification, such as microchipping and ear notching. So Bostwick is here with us for some treatments today. Ideally, you want to keep the temperature between 65 and 75 degrees with a relative humidity of about 40 to 60%. Bostwick has bedding here that they took from some of the bedding at home just to keep his scent on him so he stays comfortable. The bedding should be non-toxic, absorbent, soft, and dust-free. You can use wood shavings and corn cobs, but never a cedar wood product. The bedding should be changed as needed. His diet should consist of a rodent pellet. Usually any commercial rodent pellet diet would be nutritionally adequate. So it comes in the form of a pellet, and they continuously gnaw on that throughout the day in several small meals. Also, water should be provided at all times, usually in this hanging feeder water bottle, but it's important to make sure that the tip's not made of rubber, as they will chew on that. Enrichment is an important part of the mouse's life. It should be provided to them in their cage environment. Since Bostwick's here at the hospital and he's not in his normal cage, he doesn't have a whole lot going on as far as enrichment. He does have a few little paper tubes that he can hide in, but it's important to provide enrichment. Mice like to nest and burrow, so it's important to provide them with adequate bedding and little igloos or huts that they can hide in. I have a picture here of a little type of box that they can kind of make their nest area. It's also important to provide little hiding tubes, mazes that they can kind of run around in. I have a picture here of a really good enriched cage. It has little tubes. An exercise wheel is very important for them to run around on. Another behavior that they like to do is gnawing, so providing them with wood sticks, they can perform that behavior. So usually the toys that they provide at the pet store, they can be unsuitable if they have a toxic paint or plastic that the mice can chew on, so it's important to provide a safe toy if you're going to use that. But I think as far as enrichment, if you have forms of exercise, bedding, and areas that they can nest and burrow in is adequate enrichment. Recognizing mice as a species, they can be recognized by their very small body weight, typically between 20 and 60 grams. Mice also have a very long tail. It's actually longer than their body length, and that helps with balance as well as to dissipate heat since they don't have sweat glands. Mice also have pairs of continuously growing incisors, which is important to address with their diet. Mice can vary in coat color. Bostwick here is a nice brown. Mice also have 4 digits on their two front limbs and 5 digits on their hind limbs. We'll be demonstrating how to restrain a mouse. So what I have here is my dominant hand. I'm scruffing the top of his neck and just pulling back the skin on either side of his mandible, so that way his head is immobilized. And then what you also can do is hold at the base of the tail, and that can allow you to get your scruff handy. And then you can put the tail between the hand on this side just to, again, stabilize the bottom half of him. I'll be demonstrating how to sex a mouse. So we have the presence of testicles here, as you can see at the bottom. And then in rodents, the anogenital distance in males is a lot farther away than in females. So this distance right here. And then you can also just tell by the presence of a penis. I'll just do a brief overview of reproduction in mice. So the onset of puberty in mice is about 35 days, with sexual maturity being complete in males at 50 days and in females about 50 to 60 days. Females are spontaneous ovulators and continually polyestrous. They typically have about a 4 to 5 day estrus cycle. Breeding normally occurs at night since they are nocturnal, and can be confirmed in females with the presence of a copulatory plug. The gestation period in mice is about 19 to 21 days, and their size of their litters can vary between 10 and 12 pups. We'll be demonstrating how to give a sub-Q injection to Bostwick. He is our mouse patient. So for demonstration purposes, just using saline. So what we'll do is grab the scruff of the neck, make a little tent, go ahead and inject in the tent, pull back, make sure I'm not in a vessel, and inject. We'll be demonstrating how to give an injection intraperitoneal. And so what we'll do is we'll inject in the lower left quadrant. It's just the place where there's least likely to be any major organs that you're injecting into. I'm just going to be using saline. And then we'll aspirate back just to make sure, and inject. Demonstrating how to give meds orally. So I have him scruffed here, and then my helper has his tail so he doesn't flail too much. And usually they'll just bite right on it. You can just squirt right in. I'm just giving him some sterile water, just like that. So you want to just make sure to get into the space between his teeth, so then they can swallow it. Here in this cage we have Chaco. He is a Polish dwarf rabbit, which can be recognized by their two pairs of incisors. One's on the top, one's on the bottom. Bunny rabbits have long limbs. The back limbs are longer, so they can adapt to run and hop. Chaco here has thick, soft fur that can vary in color. And he is in our office kennel here, but his kennel at home is much larger. Rabbits should have a large cage so that they can exercise and run around in. You can even gate off an area of your home. Just make sure you rabbit proof it by getting rid of any hazards that they can chew on. Their cages should be lined with a paper product and cleaned and changed every day to maintain cleanliness. Alternatively, you can litter box train them. It's just important if they do use the litter box that they use a shredded paper product as opposed to a clay litter, which they could possibly ingest. Enrichment can be provided via toys that they can chew on. Daily exercise is encouraged, as well as little hiding places that you can make yourself or buy. So Chaco here has part of his diet. At home he has access to unlimited grass hays, such as Timothy hay. Water should be given at all times, preferably in a hanging water feeder like this, attached to the cage. A small portion of pellets can be given once a day. Usually the recommendation is a 1/4 cup per 5 pounds. And you can also give greens such as romaine and kale. Alternatively, you can give a small portion of vegetables like carrots. So Chaco here is staying with us for the day. He has a identification card that has his first and last name, what he's here for, the date, and his diet for the day, and this just hangs right on the cage. So when handling your rabbit, you want to make sure to be soft-spoken, as they are a prey species and they can easily become afraid. So when you go to get them out of the cage or their enclosure at home, it's best to support their hind limbs. So I'll just show you how I would get Chaco here out of the cage. You want to come a little closer? Okay. So it's good to just kind of go up to them and pet them, and then what you do is support their hind legs like this. And then what you can do is have them hide, especially if they're nervous, have them hide in the crest of your elbow. And then when placing them back in the cage, again, just support their back legs and let them run in. So rabbits can live a happy life as long as they have a proper diet, enrichment, and access to vet care. So I'll be showing how to properly restrain a rabbit. The classic way to hold is in what they call the football position. So it's very important when you're holding a rabbit to support their back as well as their back legs. So my one hand will be under the rabbit and my other hand will be on top, holding like a football. That way they can hide. They can hide their head, and then I have their back end supported. With more nervous rabbits, you can use a towel to wrap around and keep them from squirming. But this rabbit is pretty calm and she doesn't mind being restrained. So I'll be demonstrating how to sex a rabbit. We have a lop rabbit here, And so my holder has her positioned so that I can access the genital area. So what we'll do is push the hair aside so we can see. And we have a slit opening here, and the distance from the anus to the urogenital area is closer, and that also suggests that it's a female. In the male, the distance is farther away. And also in the males, in unneutered males, you have testicles that would be present, as well as a penis. I'm going to do a brief overview of reproduction. So rabbits go into puberty at different times depending on the breed. Medium and larger breeds tend to go into puberty at about 4 to 4.5 months, while smaller breeds like Choco here will go into puberty earlier. But the females typically mature quicker than the males. Females are induced ovulators, and they have seasonal variation in receptivity. They do not follow a typical estrus cycle. Instead, ovulation occurs a few hours after coitus. The gestation period is about 30 to 33 days, and the litter size is anywhere from 4 to 12 kits depending on the breed. I'll be demonstrating how to administer medications via sub-Q. So I'll have my rabbit on the table. My syringe, for demonstration purposes, I'm just using saline. So what you'll do is you'll pull the skin up and make a tent with my other finger, and we'll go ahead inject. I'll pull back on my syringe to make sure I'm not in any blood vessel, and then go ahead and inject. So I'll be demonstrating getting a blood sample from the lateral saphenous vein of Mr. Choco here. And as you just zoom in a little bit, as you can see, it's coming down my line here. So what I'll do is just hook up my syringe and draw back. There you go. When recognizing birds as a species, they have a couple unique features that differentiate them from other species. The first is their beak. Depending on the species, it can be curved or pointed. Birds also have a unique musculoskeletal system. It's very lightweight, adapted for flight. They have very thin, delicate skin, which is covered in feathers. Usually contour feathers cover their entire body and wings. These feathers, again, it's a mechanism for flight. The birds also have unique front legs in that digits 1 and 4 are oriented posteriorly, while digits 2 and 3 are oriented anteriorly. Another unique feature of birds, of course, are their wings. The wings are attached to the pectoral muscles, which are the largest muscles in the body, and they are a mechanism for flight. I'll be showing how to properly restrain a bird patient. So it's important before I go in and grab them, I'm just going to get some objective data first. It's important to observe the bird from a distance because they're very stressed animals, and stress can cause them to become ill. They have a very fragile skeletal system, so you want to make sure you're handling them with care. So get whatever vitals you can from a distance before they become stressed. And then what you'll have handy is a small towel. And go ahead and grasp his body with the towel. So what I'm doing is I'm holding his body against the back of my hand at the same time with my other hand, restraining his neck while being careful not to obstruct his airway. So I'll be showing how to trim the nails on Mr. Logan here. You could use a Dremel tool, which is electric, but I find the nail clippers tend to be a little less scary. So he's wrapped up in the towel here, and so we'll just take the tips off, just like that with my little nail clippers, while the owner's nicely holding him for me. Hi, buddy. Okay, one more. That's it. So in order to obtain objective data such as a heart rate, respiratory rate, and body condition score, it's pretty much the same as any other small animal patient, before I got Logan out of the cage, I observed his respiratory rates from inside the cage because he's a little more calm, just watching his chest rise and fall. For his heart rate, I'll just go ahead and take my stethoscope. And ideally a pediatric size would be better fitting for him. But his heart rate is pretty rapid since he's a little nervous, but the owner is holding him. And then for the body condition score, that's usually on a scale of 1 to 5. And so what you do to assess body condition is you palpate their keel bone, which is right up here, and judging, you can judge their score depending on how much fat they have covering the keel. So since I can feel his keel pretty well without having to press down too hard, he seems to be at a pretty ideal body condition score.